My name is Jean Francis. I'm the volunteer coordinator for Holy Redeemer Hospice. Hospice is a philosophy of care for people who are dealing with a life-limiting illness. And it is a philosophy of care that is delivered to both patient and to family. That's a huge distinction between traditional medical care. So it is about promoting dignity, respect, and also support, and it's about comfort care. So when a patient is dealing with the end of the line in terms of aggressive curative care, hospice is truly the something more that we can do. Any patient who is facing a limited life expectancy certainly can benefit from the team approach that hospice provides. So we're talking about people who need not only physical symptoms under control, but we're also talking about a holistic plan of care. So it's about dealing with the emotional issues. It's also dealing with the spiritual aspect and even the social isolation. Many people who are in, the end stages of aggressive treatment do not look and feel the way that they used to and are often reluctant to have people come and visit. So we address all of that. It's a team approach. So it's not just one person taking care of the needs for that patient and that family. It's a nurse, it's a social worker, it's a chaplain, it's a home health aide, it's physical therapy, occupational therapy, and volunteers to really address all of the social, psychological issues that can occur when somebody is dealing with the end of their life. Dying is a really dynamic time in life. There's so much to do, and that sounds counterintuitive to what our culture believes, but really, as your life is coming to an end, trying to figure out what you did in your life, and we also often encourage patients to do life review, reevaluate their life. Hospice is for patients who have been deemed by a physician to have 6 months or less to live. So it's much better if the hospice team can come in at 6 months or less. What is the harm in having that additional support earlier in your disease process than at the very end? At the very end, there's panic, there's stress, there's not enough time to do what we want to do in terms of creating our last wishes. So the concern that we as hospice workers have is that we're not giving enough time, and we need to have those conversations way before people even begin to become sick. Pulling your loved one aside and saying, what will you want when you die, not if you die?